Penicillins versus Doxycycline versus Sulfamethoxazole. In this video, we will be comparing three commonly used antibiotics: penicillins, doxycycline, and sulfamethoxazole. Antibiotics are essential drugs that are used to treat bacterial infections. However, the choice of antibiotic depends on the type of bacteria causing the infection, the severity of the infection, and the patient's medical history. Each of these antibiotics has unique characteristics, including mechanism of action, indications for use, contraindications, side effects, and treatments. By the end of this video, you will have a better understanding of the differences between these antibiotics and be better equipped to make informed decisions about their use. Penicillins are a class of antibiotics that are used to treat a variety of bacterial infections. They were the first antibiotics to be discovered, and they remain one of the most widely used classes of antibiotics today. Mechanism of action: penicillins work by interfering with the cell wall synthesis of bacteria. They bind to and inhibit the activity of an enzyme called transpeptidase, which is involved in the cross-linking of bacterial cell walls. This leads to a weakening of the cell wall and ultimately to bacterial cell death. When to use them? Penicillins are commonly used to treat infections caused by bacteria such as Streptococcus, Staphylococcus, and Pneumococcus. They are also used to treat infections of the skin, respiratory tract, and urinary tract. When not to use them? Penicillins should not be used in patients who have a known allergy to penicillin or other beta-lactam antibiotics. They may also not be effective against some bacterial infections that have developed resistance to penicillin. Side effects: the most common side effects of penicillins are gastrointestinal in nature, such as nausea, vomiting, and diarrhea. Some people may also develop an allergic reaction to penicillin, which can range from mild symptoms such as hives to severe anaphylactic shock. Other side effects can include skin rash, fever, and joint pain. Treatments: if a patient experiences an allergic reaction to penicillin, they may be given antihistamines or corticosteroids to help relieve symptoms. In severe cases, they may need to be given epinephrine or other emergency treatments. If the side effects are not severe, the patient may be switched to a different class of antibiotics to complete their treatment. Doxycycline is a type of tetracycline antibiotic that is commonly used to treat bacterial infections. Mechanism of action: doxycycline works by inhibiting bacterial protein synthesis. It binds to the 30S subunit of bacterial ribosomes, which prevents the attachment of aminoacyl tRNA to the ribosome and ultimately leads to inhibition of bacterial protein synthesis. When to use them? Doxycycline is commonly used to treat infections caused by bacteria such as chlamydia, mycoplasma, and rickettsia. It is also used to treat acne, rosacea, and malaria. When not to use them? Doxycycline should not be used in children under the age of 8, as it can cause permanent staining of teeth and affect bone growth. It may also not be effective against some bacterial infections that have developed resistance to tetracyclines. Additionally, it should not be used in pregnant or breastfeeding women, as it can affect fetal bone development. Side effects: the most common side effects of doxycycline are gastrointestinal in nature, such as nausea, vomiting, and diarrhea. It can also cause photosensitivity, which makes the skin more sensitive to sunlight and increases the risk of sunburn. Other side effects can include dizziness, headache, and yeast infections. Treatments: if a patient experiences side effects from doxycycline, they may be given medications to help relieve symptoms. Photosensitivity can be prevented by avoiding sun exposure or wearing protective clothing and sunscreen. If the side effects are severe or persistent, the patient may be switched to a different class of antibiotics to complete their treatment. Sulfamethoxazole is a type of sulfonamide antibiotic that is commonly used to treat bacterial infections. Mechanism of action: sulfamethoxazole works by inhibiting bacterial folic acid synthesis. It competes with para-aminobenzoic acid, PABA, for the active site of an enzyme called dihydropteroate synthase, which is involved in the synthesis of folic acid. This leads to a depletion of folic acid in the bacteria, which ultimately leads to bacterial cell death. When to use them? Sulfamethoxazole is commonly used to treat urinary tract infections, respiratory tract infections, and skin and soft tissue infections caused by bacteria such as Escherichia coli and Staphylococcus aureus. When not to use them? Sulfamethoxazole should not be used in patients who have a known allergy to sulfonamides. It may also not be effective against some bacterial infections that have developed resistance to sulfonamides. Side effects: the most common side effects of sulfamethoxazole are gastrointestinal in nature, such as nausea, vomiting, and diarrhea. It can also cause hypersensitivity reactions, which can range from mild skin rashes to severe allergic reactions such as Stevens-Johnson syndrome. Other side effects can include headache, dizziness, and photosensitivity. Treatments: if a patient experiences an allergic reaction to sulfamethoxazole, they may be given antihistamines or corticosteroids to help relieve symptoms. In severe cases, they may need to be given epinephrine or other emergency treatments. If the side effects are not severe, the patient may be switched to a different class of antibiotics to complete their treatment. In conclusion, penicillins, doxycycline, and sulfamethoxazole are all important antibiotics that have been used for many years to treat a variety of bacterial infections. Each of these antibiotics has its own unique set of characteristics, including mechanism of action, indications for use, contraindications, side effects, and treatments. By understanding the differences between these antibiotics, healthcare professionals can make informed decisions about which antibiotic is the best choice for a particular patient and infection. It is important to note that antibiotics should always be used responsibly to prevent the development of antibiotic-resistant bacteria. Thank you for watching this video, and we hope you found it informative.